Hello PPMA family, Dr. Weiss here. It's time for your weekly doctor video. And today I'd like to talk to you about something that I know is top of mind for all of us, and that is testing for the coronavirus. Broadly, there are two types of tests. The first test checks to see if the virus is actually present in a patient's body. The second test checks for antibodies in a patient's blood. The virus test, sometimes called a PCR virus analysis, is done usually by obtaining a nasal swab from the patient. The specimen is then subjected to a fluid that actually breaks the virus particles apart, and then they do a test to see if the RNA that's inside the center of the virus is actually present. There have been about 3 million of these tests done in the United States, and while that sounds like a lot, remember that there are over 300 million people in this country. So that's less than 1% of the population. The other test, also called a serology test, actually checks to see if there is antibodies in a patient's blood against the coronavirus. Currently, the FDA has allowed only one of these tests to be marketed, but there are 70 in the wings. Dr. Van Meter and I send the vast majority of our blood tests to a company called Quest Diagnostics, which is the largest national lab. As of today, unfortunately, they do not have this antibody test, so we cannot even order it for you. You may have seen that at Stanford University, they have developed this type of test and have said that they want to test an awful lot of people in Northern California. The lab can do about 500 tests each day, so I want to put that into perspective for you. It would take them over a month to test the entire student and faculty population in their own university. And if they wanted to test everyone in Palo Alto, California, it would take an additional 4.5 months. So while this is coming, it's still not here yet. Now, what I read tells me that both types of testing should be ramped up significantly by next month or May of this year. And I know how anxious we all are to get back to some semblance of normal life, but these are two of the very important tools that we'll need to be able to do that safely. So hang in there, it's coming. We will get there, and this too shall end. If you have any questions for us, please feel free to reach out to the PPMA staff, to Dr. Van Meter, or to me. And as always, we wish you the best of health and want you all to stay safe.